production of ultrasound. So when you actually hear the didgeridoo, that part that you're feeling, that's actually ultrasound. And the didge is producing harmonics between 0 and 1,000 hertz. So it's going down into an inaudible range of sound, and medical ultrasound, Western ultrasound that they use in hospitals, chiropractors, massage therapists, physical therapists, they have the potential, they actually go down to 2.2 hertz. And this has the potential to go 2.2 hertz lower than what they go. When you're using a medical ultrasound machine for skeletal muscular work, relieving muscle tension, stimulating bone growth, whatever they're using it for in physical therapy, there's one catch. You can't use it on people with metal implants, because medical ultrasound, when run across a metal implant, has the potential to create a microwave and cook a person from the inside out, which is very, very bad. And it's really a bummer for people that have metal implants, because ultrasound has been proven to stimulate bone growth in breaks, fractures, and bone surgery. And how I first found out about using the didgeridoo for skeletal muscular work, I met a woman in the sweat lodge 7 years ago who had broken her back in Holland. And at that point, when she had broken her back, it had been 15 years since she had broken her back, so this is 22 years ago she broke her back in Holland. And part of her post-operative support work was having 2 didgeridoo players play on her back for an hour a day, stimulating the bone growth. So the first way it affects a person is very physiological. It's not magic, it's not rocket science. They've been using ultrasound since the late 50s, early 60s for everything from stimulating bone growth, relieving muscle tension, relieving muscle rotting. And what's happening is it's forming the muscle from the inside, is what ultrasound does. And the part about stimulating bone growth, there's not 100% conclusive understanding as to what it's doing, but they know that the shock waves do something to stimulate the bone. And I've done post-operative support work with shoulder replacements, knee replacements, pins that have been set into bones, and have found that there is definitely an accelerated healing, and even to the point where a couple of doctors have looked at the x-rays, especially the shoulder replacement. I did a lot of work with that person. They had not seen bone growth around the ball socket that had been screwed in, because it was a replacement ball socket that was put in, so where it actually joined the bone. They had commented on how, to the person, the client that I worked on, that was something that they hadn't seen before. It looked like the bone was trying to grow itself onto the metal, which was very unusual for them. And of course, she didn't say that she'd been coming in to get sound therapy work. She didn't want to see it in that. Different doctors. And I've also done support work with breaks and fractures. And again, you see anywhere from 2 to 3 on the average, as much as 4 weeks taken off of normal healing time for a break and fracture. One of the most dramatic ones was a 6-year-old girl that broke both of her arms falling off of the slide at the playground. And one was fractured almost to the point of breaking, and the other one was a clean break. And within 3 weeks of coming in for 2 sessions a week, the fracture had healed back to the point of didn't need a cast anymore, and they were amazed because it was like 3 weeks ahead of schedule. But the really amazing part was that they were able to pull the cast off of the break, because it had healed up to the point of a fracture that it didn't need to be casted anymore. So again, not magic, not rocket science, just the wonderful effects of ultrasound. And the second way the instrument affects a person is through the energetic. And it's very much like a Reiki or Qigong power washer. Does everyone know Reiki, Qigong?
Actually, could you explain?
Yeah,
if you don't mind.
So Reiki and Qigong are